Mr. Speaker, I remind my colleague from Texas that his vote for this bill will result in 61,900 people from his congressional district losing health coverage and care.
Mr. Speaker, I would remind my colleague that her vote for this bill will result in 63,000 people in South Dakota losing their health care coverage and care.
Mr. Speaker, I remind my colleague that in Mr. Barton's case, his vote for this bill will result in 64,900 people from his congressional district in Texas losing health coverage and care.
In a few minutes, Mr. Speaker, you're going to hear somebody from the other side say that a bunch of my constituents are going to lose coverage. That is absolutely false. Those constituents are getting their freedom back to choose whether or not they want health care coverage and what kind of health care coverage they want. I say vote yes. Thank you, Mr. Speaker. I yield back.
From Georgia that nearly 700,000 Georgians have chosen to either pay a fine or exempt themselves from Obamacare because it has failed them so bad. And my friend from Michigan, 420,000 Michiganders, more than half, chose to exempt themselves from Obamacare rather than accept that failed health care. I would remind my friend from Connecticut that 190,000 residents of Connecticut, 2 out of 3 eligible for Obamacare, believed it failed them so bad they paid a tax or exempted themselves.